Good afternoon. It's exciting to be here. I'm glad to see such a great crowd here. And I'm the Regional Medical Director of Emergency Services here at Mercy, and it's a real privilege to be able to provide work in this role with this wonderful trauma team. And I've been asked to address two questions today. The first question is, what is a trauma patient? We tend to classify trauma patients into two classification or two categories. The first is a critical trauma patient, and the second, a modified trauma patient. Critical trauma patients are defined as those who EMS or a transferring facility determined to have potentially imminent life-threatening injuries due to severely abnormal vital signs or due to their mechanism of the trauma. And some examples of this type of patient is a patient with a very low blood pressure, very hypotensive, significant body burns, paralysis due to a spinal cord injury, penetrating injury from a gunshot wound to a head, neck, chest, abdomen, or an extremity with a vascular compromise with severe blood loss. The second classification that we have is a modified trauma patient. A modified trauma patient are those who EMS or a transferring facility feel meet criteria requiring urgent evaluation of their injuries at a trauma center but do not meet the most severe life-threatening criteria. And an example of a modified trauma patient is an individual ejected from an enclosed vehicle, from a motor vehicle accident. Another example is an isolated amputation above the wrist or the ankle, a bicyclist thrown or run over, a crush injury to the head, torso, upper thighs, or a motor vehicle rollover. We here at the Mercy Trauma Center have 2 trauma rooms that are designated and dedicated for treating the most critical trauma patients. Additionally, we have a core group of 11 emergency medicine trauma residency trained physicians. This new core group of physicians has been developed over the course of the past year to enable us at Mercy to offer state-of-the-art, best practice, evidence-based emergency trauma medicine. Moreover, all our nurses are trauma trained, enabling them to care for the most critical trauma patients. Over the course of the past year, we have witnessed a significant improvement not only in the quality of care we provide, but also with our service. We are committed to providing service excellence in everything that we do, and we have witnessed a significant raise in our overall patient satisfaction scores. The second question that I've been asked to address is, what does a level 2 mean to our ED patients? A level 2 means to our ED patients a multidisciplinary team approach that provides optimal medical care. It means healthcare delivery by a highly trained, highly qualified new core group of emergency medicine trauma physicians. It means service excellence with the practice of evidence-based medicine. It means the provision of best practice medicine by a trauma-trained nurses led by a nurse leader with close to 30 years of experience. It means a trauma program and emergency department with a leadership team with over 100 years of experience combined. It means the trauma patient will receive timely trauma medical care that our community members, surrounding members, and patients deserve. It is a true privilege for me to be a Mercy partner and to be a part of the Mercy's Level 2 trauma team. Thank you.
Good afternoon. I'm Ron Whitney, the Director of Trauma Services at Mercy Hospital. Thank you very much for coming out today. I'd like to first publicly thank, before we get into the presentation, Laurie McKibben, our Trauma Nurse Coordinator, and Barb Hermaning, our Trauma Data Analyst, for making our program happening and keeping us all in line. As Mr. Bay said, this week, the American College of Surgeons verified that our trauma program meets or exceeds all of the rigorous standards that are required as far as resources and quality of care to care for trauma patients at the Level 2 status. What are these resources that Mercy puts forth that meet and exceed? In the pre-hospital, as Chief Groward and Deputy Chief Lighting alluded to, Mercy has had a long-standing history in EMS. Our Mercy Paramedic Training Program has trained more than 180 regional EMS providers. Our Mercy Regional EMS Training Center is the only training center in the region and provides continuing local EMS training for over 300 EMS providers. They also provide training for adult and pediatric, advanced life support for doctors and nurses at our hospital, and basic life support for the community people. Mercy is medical control for the Janesville Fire Rescue, Milton, Footville, Orfordville, Broadhead, and Evansville EMS services. As far as in-hospital, we have 24/7, 365 coverage of the trauma service, orthopedic service, neurosurgical service, and cardiothoracic service to care for trauma patients. These services are augmented by, as Dr. Milos said, the ability of our highly trained emergency staff in the initial assessment and evaluation and care of the trauma patients, by the anesthesiologists who staff our operating room, which is available immediately to care for those patients needing to go directly to the operating room. Critical care doctors in our newly renovated 15-bed intensive care unit. Hospitalists to care for ongoing medical issues of our patients once they get out of intensive care. Interventional cardiologists, 2 cath labs, echocardiography, interventional radiologists with state-of-the-art equipment, and an interventional suite to allow non-invasive control of massive hemorrhage. We have ancillary services for the patients and, most importantly, for their families. Spiritual care, care coordinators, social workers to assist the patients in the initial traumatic event and also to assist them through their entire course in the hospital and as follow-up once they leave. When needed, we have palliative care doctors and nurses who are available to assist with comfort care and grieving process. Mercy's extensive resources include major rehabilitation resources. That includes doctors, physical therapists, occupational therapists to assess the patients in hospital and to follow them through their entire course. We have an on-site acute rehabilitation institute that cares for patients to handle aggressive therapy once patients are too strong to stay in the hospital. For those patients who can't handle the aggressive therapy, we also have an on-site assisted living where patients can receive continued treatment and care until they are able to go home. Once they reach the status of being able to go home, they may still need some help, and we have home health care to deliver care to their homes on a continual basis. Once they do leave our hospital, we have extensive clinics for follow-up and equipment